This is a video of an arthroscopic repair of a rotator cuff tear in the left shoulder. The tear involves the leading edge of supraspinatus. We're viewing through the posterior portal, and a suture pass-through has been passed through the lateral portal. The leading edge of the cuff is grasped, and a suture passed from the inferior surface of the rotator cuff to its superior surface. A hook is then introduced into the subacromial space to engage with the loop of suture. The suture is then advanced through the rotator cuff and then grasped through a new anterior portal. A satisfactory bite of the rotator cuff has been achieved. The suture pass-through is now removed and the process repeated. The loop of suture is grasped by the suture retrievers and pulled back through the proximal cannula. Having achieved 2 good bites of the rotator cuff tendon, we are using an anchor which is hammered into the greater tuberosity distal to the attachment of the supraspinatus. The advantage of this particular type of technique is that it allows a late tensioning of the rotator cuff repair to be achieved, as you will see. The metal tip of this Smith & Nephew suture anchor prepares a small tunnel for the subsequent interference screw. Here, a hook is introduced through the second anterior portal to check on the tensioning of the sutures. The advantage of this system is that late tensioning can be achieved. As the sutures are pulled upon, one can see the cuff advancing to where one wants it to attach. Now you can see the interference screw being inserted to fix the sutures and tendon at the correct position and tension. As the screw is tightened, so the cuff is advanced and repaired down onto the humeral head. Finally, through the proximal portal, suture cutters are passed and the sutures cut. In this fashion, a satisfactory single row technique repair of the rotator cuff is achieved. This process is repeated depending upon how many sutures are required to achieve your repair. the interference screw is finally countersunk.